Hey, what's going on, guys? And welcome back to another video of Keep It Simple Stupid. And today we're going to be discussing neurogenic shock versus spinal shock. What are they and how are they different? And as usual, I'm going to try my best to make it very simple for you guys. So this is a tricky one here. These are terms that I've heard pretty frequently while I've been in training. And frankly, there was a lot of confusion for me between these two. And I remember getting pimped by an attending. And it became pretty obvious to both myself and the attending that I didn't really know much about the difference. Thus, I'm now making a video, so hopefully that if you all are faced with that situation, you will answer correctly and there will be no problem. All right, let's go ahead and get into it. First things first here, I think it's very helpful to just discuss the basic definitions. So the definition of spinal shock is that it is total or near total areflexia with complete loss or suppression of motor function and sensation distal to an anatomical lesion. So that was a mouthful, but here's the very basic way I think it's helpful to think about it. You have your spinal cord, you have an injury to the spinal cord, and you have basically lost all your neurologic function below that lesion. So that's muscle movement, sensation, and then of course reflexes. So we discuss spinal shock, so then what is neurogenic shock? And the definition of neurogenic shock is that it is supine systolic blood pressure less than or equal to 90 millimeters of mercury with a heart rate less than or equal to 60 that cannot be attributed to hypovolemia, blood loss, dehydration, sepsis, or cardiac disorders. So basically, neurogenic shock, you have a low blood pressure and a low heart rate. And then again, the way that this definition kind of paints it is it makes it almost look like a diagnosis of exclusion. But I would say, to make it more simple for you guys, is that the context of neurogenic shock, I mean, I'm sure there are other examples where you could see this, but from my limited experience, I basically only see neurogenic shock in the setting of a spinal cord injury after trauma. So the hypovolemia, blood loss, dehydration, I think that, again, makes it seem like a diagnosis of exclusion, but a lot of the times, if you have someone who was involved in a really bad trauma and they can't move anything, obviously in a bad trauma, you're still thinking about hemorrhagic shock from blood loss, but again, neurogenic shock I've almost exclusively seen in the setting of a traumatic spinal cord injury, but again, that's not to say that that's the only way that you could see it. So we've gone ahead and discussed the definitions of both spinal shock and neurogenic shock, so I thought it would be helpful to just do a little side-by-side chart with some of the very basic information so that you can help distinguish these. So in the setting of spinal shock, this is something neurologic. Again, we've lost sensation and we've lost reflexes below the level of a spinal cord injury. Neurogenic shock, this is something you will see with the vital signs. All right, so think cardiovascular changes and hemodynamics. Again, that blood pressure less than 90, that heart rate less than 60. So if you're talking about neurogenic shock and talking about neurologic findings, you'd be confusing someone, because neurogenic shock, you're thinking about cardiovascular. Spinal shock, you're thinking about actual neurologic findings. So spinal shock, neurologic findings, neurogenic shock, that's a diagnosis you make based on vital signs. And then finally, I'm just going to very quickly give you guys a breakdown of how exactly neurogenic shock occurs. I think it can be very helpful. So first of all, here's my very basic drawing of a brain stem, and then finally the spine, which is this kind of whole area right here. C-spine, cervical spine, T-spine, thoracic spine, L-spine is the lumbar spine, and then the sacrum, so on and so forth. So this is how I think it was helpful for me to think about neurogenic shock and why it occurs. I'm not going to get into it super deep for the purpose of this lecture, but it's helpful to know that there are two types of autonomic innervation that we have in our bodies. So there's sympathetic, I have here in the gold, and there's parasympathetic. So parasympathetic, you may have heard, it is your rest and digest portion of your nervous system, where the sympathetic chain is the fight or flight. So in very basic terms, the way I like to think about it is that your sympathetic chain is involved with clamping down, so making your heart rate go up and your blood pressure go up, and then it also clamps down, so it vasoconstricts the peripheral blood vessels in our bodies. From the parasympathetic standpoint, well, it's kind of the opposite of that sympathetic effect, so it makes your heart rate go lower, and then also it'll drop your blood pressure. Drawing this back into the context of neurogenic shock, if you think about our fancy spine that I've drawn here on the left side of the image, the sympathetics that supply the heart are in the spine regions of T1 through T4/T5. All right, and then I did T4/T5 because when I was researching for this video, apparently there's some variation in individuals. Like some people will get T4, some people will get T5, whatever. Not really important. The important thing is to know that the sympathetic innervation to the heart is from T1 through T4/5. So why is that important? So if we know that these levels here on the right are the ones that provide sympathetic innervation to the heart, well, that tells us if we're at T6 and we have an injury above T6, well, there's a pretty good chance that there was damage to the sympathetic chain that innervates the heart. And again, why is that important in the setting of shock? Well, if you have damaged the sympathetic supply to the heart, now you have unopposed parasympathetic, right? And if you have unopposed parasympathetic, well, now you have a low heart rate and a low blood pressure because now you're lacking that ability for the sympathetic chain to provide that vasoconstriction peripherally, and it's not able to increase your heart rate and increase your blood pressure. All right, and again, this makes sense with the definition of neurogenic shock because you have a low heart rate and a low blood pressure. All right, and then again, very quickly here, just remember that parasympathetic supply, it comes from the C-spine here, and then the sacrum down here, and then the sympathetic innervation, it's referred to as thoracolumbar, so it's going to be from around T1 to L2, L3. Right, and then finally, while I have the diagram here, spinal shock, say you have an injury, so say C7, say you have an injury here. Spinal shock is essentially the finding that you have now lost all the motor, sensory, and reflexes below this spinal level. The last little point I'm going to make here is that spinal shock can last anywhere from 3 to 6 weeks. And then why is that important? That is important because if you want to neuroprognosticate, aka a patient has an injury to their spinal cord, you want to know what they can get back and what they can't get back. Well, unfortunately, a lot of it's just kind of a waiting game, and you just have to see what slowly returns over time. I hope that was helpful. That's all I have for you guys today. As always, like, comment, subscribe. Also, thank you to everyone who is newly subscribed. We're getting close to 200 subscribers. That would be a great milestone to hit. Thanks for tuning in. Thanks for watching, and I'll see you guys next time.